Hello viewers, my name is Damilari. In this lesson, we'll be looking at the topic part of the mammalian skeleton, which is the continuation of supporting tissues in skeleton that you will see in the other video. So looking at parts of the mammalian skeleton, we have number one, axial skeleton. How will you remember axial skeleton? You can use your axis, that's in mathematics, y-axis, something that is at the center to remember. So meaning that for axial skeleton, this is a type of skeleton that deals with bones at the center. That means the center bones are they make up the axial skeleton. But those skeleton or bones that are away from the center, we call them appendicular. So the examples of the axia which are at the center, they include the skull. So this skull here is an axial skeleton because at the center. If you continue the drawing again, coming down like this, all these bones that are long, so they call them the vertebral column, is also at the center, axial skeleton. This one that looks like thigh, so which is called sternum, is also axial skeleton because at the center. These ones that are round, all these curved parts called the ribs, they are also at the center, so they are axial. So the skull, the vertebral column, the sternum, and the ribs, they are axial because they are all at the center. But when you look at appendicular, it means you are going away from the center, just like the way you can stretch out your ends. So we can stretch out our ends with the help of a bone that is here. And what is the name of that bone? That's scapula. So it's the one I brought out here. So this scapula here, with the bone you are stretching itself, which is this humerus. So the humerus is one I drew here. So the humerus you are stretching and the scapula where it is attached to, both of them, they make up what we call what? Pectoral girdle. Pectoral girdle. So that's one of the words, one of the appendicular skeleton. So that's number one. So mean that number one appendicular skeleton is a girdle. So we have girdles and we have limb. So the first girdle here is the pectoral girdle, which is at the hand. So that's pectoral girdle. Then we also have pelvic girdle. The pelvic girdle, that's the one in the waist. In the waist. So this drawing you are seeing here, this is just part of the drawing here. So and that's where another bone, this long bone, is attached to it. So combination of this pelvic girdle and the long bone here is another appendicular skeleton. So from the one I gave you on top here, we call that one the pectoral girdle. Then the one under here, the pelvic girdle. So mean that pectoral girdle and pelvic girdle, they are appendicular skeleton. So, and looking at that pectoral girdle again, if you come up, so we have said here we have a long bone here called humerus. It's part of appendicular. There's still another long bone here which is called radius and ulna. Is labeled here, radius and ulna. So it's still part of appendicular because you can stretch them out like this. So anything you can stretch out is part of the appendicular. So meaning that the radius that is here, the short bone, the ulna, the long bone that is here, the humerus, this long bone also, and that scapula that is here, they are all appendicular. So they all make up what we call pectoral girdle. Or so that you not get confused, you can just say okay, the scapula that is here, and then there's another one here called clavicle, which is the shoulder bone. So that also is part of the appendicular skeleton, so forming the pectoral girdle. Then we can also use the word limbs. Limbs are also appendicular skeleton. When I say limbs, like these ants now, all these ones we call ants, so they can call them limbs. What kind of limb? That's four limb, four in front, just like a four-footed beast, animal that has four legs. So those legs that are in front, they call them four limbs. So just like representing the hand. But those ones that are at the back, we call them hind limb, representing the legs. So meaning that these legs here represent the hind limb. So they are also part of appendicular skeleton. So we have looked at axial skeleton, those ones that are the center, which are the skull, the vertebral column, the rib cage, and the sternum. Sternum is also known as breastbone. The appendicular skeleton, we have talked about pectoral girdle, that's found at the hand region. Pelvic, found at the waist region, pelvic girdle. Then limbs. So as I said, the forelimbs and the hind limbs, talking about the hands and the legs bones. So that's for appendicular skeleton. So the next thing is for us to look at the different parts of the skeleton. So for the different parts of the skeleton, it means if you are told to draw a skeleton, how would you draw a skeleton? The first thing is um, we take note of the skull. The skull is the first thing you see. That's at the head region. So the head region, we have the appendicular. Let me erase all this so that we can see. Okay, it's like it's not erasing. Okay, so let me undo all this so that it will be neater for you to see the diagram of the skeleton. Okay, so if you are told to draw a skeleton, so what are the things you take note of? So to draw a skeleton, you draw your skull. So the skull, this is the first drawing. So, and in the skull we have the eye sockets, we have the nose tree, we have the mandible and the maxilla. So though we still talk about all this, then from this middle here down to this place we call them vertebral column. Vertebral column starting from the neck, which is cervical. Then there are bones inside there called thoracic. There is one, so that place is chest. There is one at the abdomen, that's lumbar. The one below the lumbar, that's sacrum. Then for animal that has tail, we have cauda. So those five, they call them the vertebral column. So the skull, the skull, then the vertebral column. Then I've mentioned this one that looks like thigh. So it's the one we call the sternum or breastbone. Then this one that looks like that's the collar bone. You know, when you wear clothes, you say this is your collar. So the collar bone. Then this is the ribs, the curved parts. Then this long bone here, that's the humerus. Then the two ones that are under here, they call them ulna and radius. So radius is the smaller part. You can use the idea of a circle, that's a short line drawn to the center. Excuse me. So a short line drawn to the center is radius. So ulna, you can use letter L as a long part. So the longer part of this skeleton is, of this bone, is ulna. So if you come down again, we have the carpals. Carpals are here, so they are like eight small bones here in your wrist. Then we have the metacarpals, those ones that are away from the carpals. So that's where you have your palm. Then the tiny ones, they are the phalanges, where you have your fingers. So that's that on the upper part. Then when you come down here, this is the femur. The femur is the largest bone in the body. Then we have patella, the kneecap, so where you always knee. Then the bigger bone here is called tibia. The tiny one here is fibia. You can use letter T to represent tall. So once you remember tall, that means the bigger part. So that's tibia. Then the shorter part here, or the thinner part, is the fibula. So mean that there are two bones here in our legs. Then when you come down, that's your ankle, where you wear your socks. So it's called tarsals or tarsus. So but when you come down, you call it metatarsus. Then the toes are the phalanges. So that's the diagram of skeleton. Now another thing we want to consider is picking them one after the other. So the first part of the axial skeleton, that's the skull. So what can we say about the skull? The skull consists of two major parts. These are the cranium and the facial bones. So we have the cranium. What is the meaning of cranium? That's where they can call it brain box. So cranium is the brain box, where brain is found. So the cranium has a number of individual bones tightly fitted together at immovable. So it means the skull has immovable joints, or you call it suture joints. So but at birth, many of these joints are not completely fused together. They are separated. That's why baby's bones are more than adult bone. So because their bones are not fused together completely. So, and that's why those small bones, they call them soft spots or fontanelles. So fontanelles, so as bone leading to a number of soft spots or fontanelles. The fontanelles do not completely join until the age of 14 to 8 months. 14 to 8 months, that's after 1 year or 1.5 years, before the bones begin to join together to increase. So it is the fontanelles that enable the head of the baby to pass through the mother's pelvic during delivery. So during delivery, so take note of that, fontanelles. So though Yoruba call it awuje fontanel, so it's on top of the head. So it's always as if it's blinking. So that's the fontanel. It enables the head of the baby to pass through the mother's pelvic during the delivery. Now the main bones making up this, the cranium. You know, we have said cranium is the brain box where brain is stored. So the main bones that make up that cranium, we have the frontal bone, the one in front. So we'll see show you, okay, from this drawing here. So frontal bone, you can see the frontal bones here. So it's make up the forehead. The temporal bone, that one is at the side. So you can see temporal here, the side, close to the ear. Then occipital bone, that's the base. So occipital is at the base. So like the base here. So close to the back head, the back part of your head, that's occipital. Then parietal, so which it consists of the top and side walls. So that's parietal. So that means it's actually close to the top yet still beside. So unlike temporal is completely by the side, but parietal, so parietal is by the side but yet at the top. So these are the parts that make up the cranium, the brain box. Okay, now it is also important to know the main bones of the face, which are the cheek. So we have the cheek bone, we have the nasal, that's from the nose, we have the jaw bones. So when you talk of the cheek, so you know it's part of the face. So the cheek is part of the face. The nasal, talking about the nose, then the jaw bones, so the maxilla and mandible. So the upper part is called maxilla, you can use maximum to remember up. Then the lower part, mandible, the D to remember down, D mandible for down. So that's for the jaw bones. So the jaw bones consist of the okay, so I've mentioned that so that I've not waste time on that one. So this alignment of the jaw bones enables the mouth to open and close. Now from this skull here, we can see that there is something we call orbit. Orbit is the eye socket. So the eye socket where the eyes is fitted into is called orbit. So then we have seen maxilla, the upper jaw. So then the mandible, the lower jaw. That is, those two things are opening our teeth. Now let's move to bone or vertebral column. So we are done with the skull. So from the vertebral column, which is another axial skeleton, there are 33 short bones in the vertebral column. So, and what is the functions of the vertebral column generally? You know, when we talk of vertebral column, we have the cervical, we have the thoracic, we have the lumbar, we have the sacral, we have the caudal. So all of them generally now, what is the general function of the vertebral column? So number one, it protects the spinal cord. So meaning that the spinal cord is entering into all those vertebral column. So it's protecting spinal cord. Number two is we support the weight of the body. So it supports the weight of the body. So meaning that when you have um, the skull on top here, you have different parts of the ribs and many other things. So all of them, they are attached to this center bone. So this center bone is like a pillar. So that's why it's at the center, like a pillar. So it supports weight of the body. Then it can absorb shock from a fall, jump, or blow to the body. So they help you to absorb shock. So if you fall down, you should know is this body part that will lay to the ground. So it means as it's laying to the ground, it will prevent shock. so it will absorb the shock, then it enables the body to bend. So if you want to bend, you can twist these bones, you can twist them, and that's why it is believed that the shape of human body is S, so S shape. So this vertebral column you are seeing, talking about the cervical, the thoracic, so they are in S shape, so meaning that is helping us to bend. So that's for that one. Then it provides surface for attachment of muscles. So muscles are attached to this same set of bones, so we put muscles on them, so for attachment of muscles. Then okay, so that's that for the functions of the vertebral column. Then the vertebral column consists of the following, so I've mentioned them. So the cervical, thoracic, lumbar, sacral and caudal. If you want to remember them, you can just use, as if you want to spell cutlass, in the spelling of cutlass, you can put U here, you can put A here, you can turn this C to S, that's cutlass. So meaning that this is cervical, thoracic, lumbar, sacral, then caudal. So these are the 5 vertebral column. Now let's look at their locations. The first, cervical, that one is found at the neck region, and there are 7 in number. If you want to remember, use letter S. If you want to spell 7, S. Thoracic, there are 12 in number, use letter T from thoracic, 12. Then lumbar, there are 5 in number, use F. Sacral, there are also 5 in number, use F. Caudal, there are 4 in number, that's, I'm talking about human being now. So for human being, so 4, so meaning that the 7 plus 12 plus 5 plus 5 plus 4 will give us 33. That's in human being. So that's for the numbers of bones in humans. So I've actually shown you all these bones in the skeleton that I showed the other time. So look at the skeleton here. So the first one here at the neck, that's the cervical. um in the middle here, though this is not the thoracic but it's in the middle, that thoracic is at the chest. This is a continuation. Thoracic, there are 12 in numbers if you count. The cervical, there are 7 in number. Thoracic, here there are 12. Then um lumbar lumbar is at the abdominal, there are 5 here. Then sacrum, they are here, they are fused together, there are 5 fused together here. So then caudal is 4, is one that formed tail, just that human being doesn't have tail. So instead of tail, we have coccyx. So you call it coccyx. That's Coccyx. So that's coccyx. So it's one that is representing the tail of human. So there are 4 in number. So these are the vertebral columns. Now the next thing is, we have seen that all the vertebral column are 33 in human beings. Now let's now look at other animals like rabbits and rats. How many of these vertebral column do they have? So to start with, if you look at the rats and the rabbits, they all have the same cervical, that means the same number of bones in the neck region. Then when you come to thoracic, rats has extra one. So but rabbit has between okay, it's either the same, like 12 to 13. It means it can be exactly 12, it can be more than 12. So let's just put extra one also. Then for the lumbar, that's at the chest region. So rat has extra one, rabbit has extra one or two. Then for the sacral, which is the lower abdomen, rat has less than one, less than one. Then rabbit has less than one or less than two. So therefore caudal, so for human we said is 4, but for rats they have 27 to 30. So because they have a long tail. So then for rabbits, their own is 16. So meaning that they have like extra 12. So and that's why the total number of bones, or let me say vertebral column in rabbits, they are 44 to 47. In rats, 57 to 60. But in man, it is 33. So how will you remember? You start based on the spelling. that for man is 33. Then rats, we said, so rats is the one that is having the highest. So meaning that the animal that appears to be the smallest of these three is now the one that has the highest number of vertebral column, 57 to 60. Then rabbit also follows in terms of size. Rat is the smallest, then rabbit is bigger in terms of size, but in terms of vertebral column is the rat that has the highest vertebral column, followed by rabbit, which is between 44 and 47. So how are you going to remember all this? Just start by saying, since you have known that of man as 33, 33, then it means rabbit will now be 44. So 33 for man, 44 for rabbit. The rat will now be, instead of 55, you say add extra 2, maybe extra 2 from the rabbit and man. So just use that to add to the 55 so that you become 57. So 33 for man, 44 for rabbit. Instead of 55 for rat, you add extra 2 to make it 57. Then you put range, that the range in rat is 3, that was 57 to 60, while the range in rabbit also is 3, 44 to 47. So that's how to remember all those bones. So let's move to cervical. I want to focus on the cervical vertebra. That's the one that is found at the skull, the neck region. Now at the base of the skull, because after the skull it is the cervical you will see. So the vertebral column starts with the cervical vertebra. So there are 7, as I said earlier. So the first cervical you see, they call them atlas. The second one is axis. So meaning that atlas and axis are the first, while the third to 7 bones, they are the normal cervical bones. Now, what are the characteristics of cervical vertebra? Those ones that are found in the neck region. So they have centrum, and that centrum is relatively small. They have neural spine. The neural spine is short. They have neural canal. That neural canal is large. They have vertebratal canals where blood vessels are passing. Then they have cervical ribs, or you call them transverse process. So they have transverse process, so to make up the cervical vertebra. So, and as I said, the cervical vertebra is now divided into atlas and axis. So this is the atlas here. The drawing of the atlas is here. So both the anterior, that's the front view, and the posterior, so that's from the back view. So anterior and posterior of the atlas. Then this is the axis here. So now let's use the drawing of the atlas to explain the first one, the cervical vertebra. We said the centrum is small. So look at this centrum here. So this is the centrum here. So it is actually small. Centrum is just the body. They call it a body or a bone that is forming the body of that particular um, vertebra. So centrum there is small compared to this one here. You can see the one of axis. So from the axis vertebra, so this is the axis here. So actually both of them are connected together. So the atlas and the axis, so they are connected together. So just take note of the first thing we have said about the atlas, that they have centrum that is small. Then the neural spine, we said, is short, or let me just be using the drawing here. So this is the short neural spine of the cervical vertebra. So then this is the neural spine. Anything that is pointing up is the spine, so it's short. The neural spine is short. Then the centrum, so centrum is always here, so is relatively small, though not that small, so but we still have it in this form. Then neural canal. So neural canal is that big hole that is here. So that's where the spinal cord will pass. So that's the neural canal. So that one is always very large. So the centrum will be under it, which is smaller than that neural canal. Then it has two vertebratal canals. That means one tiny hole here, or two tiny holes where blood vessels will pass, the artery and the vein. So that's the vertebratal canal. Then it has transverse process, that means side bones, from the word transverse, so side bones are called transverse process. That's where bones, other bones are connected to, like the ribs. So the ribs are connected to this transverse process, and that's why they call them cervical ribs. So where ribs are attached to. Now, still looking at the cervical, so I said it's divided into two, atlas and axis. So for atlas, it has a large neural canal. So the atlas has a large neural canal. So as you can see, this is the large neural canal of the atlas. So large neural canal, it has rounded and wing-like transverse process. That means this transverse process that is beside is like round. So rounded transverse process, or wing like wing of a bird. So wing like transverse process. Then the um the neural spine is very short. So it's very short neural spine, or you say it's even absent, though it's there, so you can see very short. So that's the neural spine. The centrum is absent. That's when you are drawing atlas. So the atlas, so the centrum will not be visible, so until you now place the axis. So when you place the axis, then it will now show you the centrum. So this is the centrum here. So the centrum is here. So when you connect it with this atlas, then you can now see the centrum showing. Okay, now the next thing is it has a vertebral canal for the passage of blood vessels. So those tiny holes here, they are the vertebral canal. That's where blood vessels will pass. Now, what is now the function of this atlas? Atlas will help you to nod. You can just look at letter T of the atlas. So mean that if you want to nod your head, you bring it down like this. Use it to remember atlas. But if it is axis, you use this direction to remember rotating. You use it to rotate your head. Atlas is for nodding, but axis is for rotation. So what are the characteristics of axis? So we are moving to axis now. So for axis, it has a well-developed centrum. Remember, the centrum was not visible in atlas here. So but in axis, you will now see it well developed. So well developed centrum. Then it articulates with the atlas. So it means axis always join with the atlas through what we call odontoid process. It means there is a bone that um connect atlas with axis. See, this is the odontoid. So it's the one that always enter into the or joins with the atlas at the occipital condyle. So this is the occipital condyle. So this occipital condyle is where the odontoid process will attach itself. So odontoid process of the axis will enter or will attach to the occipital condyle of the atlas. So that's when what will make them fuse together. Now it allows, from the functions of the axis, so it allows the head to be turned easily. That means to rotate or twist your head. Then looking at the normal cervical vertebra, the normal cervical vertebra, this includes the third, the fourth, the fifth, the sixth, and the seventh cervical vertebra. So we have picked the number 1 and the number 2, but the number 3 to number 7, so they have special feature. So they have special feature of a short bifurcate transverse process. So short bifurcate transverse process. So that's for the normal cervical vertebra. Now, from this cervical vertebra, we can see the neural spine is there at the top. We can see the neural arc. So arc is just like a curved part on top of the neural spine. So this curved part on top of the neural spine is the neural arc. So then we also have the canal, which we call neural canal. So the neural canal is this big hole. So the big hole that we have here is the neural canal. And why do we call it neural canal? That means that's where the spinal cord will penetrate. So through the neural canal. So then we have another one called pre-zygapophysis. Pre-zygapophysis. So here different bones or muscles are also attached to them. Then we have the bifurcate transverse processes here. So that's on the cervical vertebra. Then the next one is thoracic, which is found at the chest region. So for the thoracic, number one, it has a long neural spine, as you can see. The other one was short, but this one is pointing upward, so it's a vertical projection. That's the long neural span. That's how you can easily identify the thoracic that is in the chest. Then we also have neural arc. So the arc means that thing that is curved where the neural canal is. Remember, this is the neural canal where the spinal cord is passing. Neural canal. So above the neural canal is the neural arc. Then transverse process is always beside. So that's where the ribs are attached. So when the ribs is coming like this, so it will attach to this part. So the same thing here. So that's facets which articulate with capitulum. Capitulum, so from the ribs. So that is attached to transverse. But then we still have some other parts of this thoracic vertebra. So this includes centrum. So this is the centrum, the body, the one I call body, like a body of bone. So that is below the neural canal. So we also have presygapophysis demifacet. Anytime you hear facets, that's where another bone can be attached to. So that's for the thoracic vertebra. Now, as you can see, the connection here, this is where that thoracic vertebra is connected to ribs. So here now the ribs, you can see the facets. So at that facet, there is a connection. So this is the capitulum. The capitulum is just part of the ribs. So the capitulum is attached to that facet. So that's why they call it facet, which articulates capitulum. So that means where the ribs will be attached to. So ribs attached to the facets. So with that, you can call it the tubercular facets. So then this is another process, transverse process beside. So where ribs is also attached to. So the ribs is a bony part. So it's a bony or a bony cuff part. So and as it's coming from that thoracic vertebra, that ribs is coming to another bone called sternum, the one that looks like thigh. So that's the sternum. So it will come and attach to it. So that's for the ribs connected to the thoracic vertebra. Now, functioning of thoracic vertebra, one of the functions of the thoracic vertebra is to support the back. So thoracic, it will support the back because it's actually at the chest region, but at the same time it's supporting the back. Their articulation with the ribs. So because ribs are attached to them, so that's why because they are attached to them, it can affect the back. So it allows them to also provide protective cage around the delicate organs. So it means as the ribs is protecting the delicate organs such as the heart and the lungs, the same way the thoracic is acting as a pole or pillar, so that is also protecting the delicate organs. So what are now the next things we are looking at? Lumbar. We have seen cervical in the neck, thoracic in the chest. Now we are looking at lumbar in the abdomen. So this lumbar, his own centrum is thick. So that's what makes this one different. His own centrum is thick. Centrum, don't forget the bone that I call body. So that's the real body of the bone. So that's centrum. So his own is thick centrum. So unlike others that are just, let's say, thin or not that large. So but for this one, it has a thick centrum for lumbar. You can use the letter L to remember that, okay, put a line here, thick. So thick centrum. Then the neural spine is stout. Stout, that means is large enough. So it's large enough. Unlike others, some were tiny or let's say short. Other one was very tiny and long. But this one not just tiny, is somehow fat a bit. So that's stout. So the neural spine is stout. Then the transverse process, they are long and broad. Instead of the tiny transverse process that we saw in the thoracic, is own. You can see how long it is. So they have transverse process that are long and they are broad. That means wide. So long and broad transverse process. Don't forget anything transverse process. That's where another bones are attached to. So there are additional articulatory processes. That means another place where bone can be attached. We call them metapophysis and apophysis. So this is the anapophysis. Another bone can attach to it. Metapophysis, another bone can attach to it. So anything on the side is bone that is attached to it. So it has well developed pre and post zygapophysis. So that's for the lumbar vertebra. So that leads us to the differences between cervical and thoracic. When we say cervical, talking about the neck bone, thoracic, the chest bone. So for cervical, which is the neck bone, their neural spine is short. So we have done that from the beginning. So if you draw it, you will see that the neural spine is short. But thoracic, you see that his own neural spine is long. Number two, prominent and bifurcate transverse process. But this one less prominent transverse process. That means the transverse process you will see in this one is just like this. So it's not that prominent. But this one is prominent. You can easily see it. You know, we say it's somehow curved or round. Somehow round. So it means it's prominent transverse process or bifurcate. Then number three, presence of vertebrational column in cervical. That means after drawing your cervical vertebra like this, you will see one hole here. So they call it vertebral canal. So but for thoracic, it doesn't have that vertebral canal. That means tiny hole where blood will be passing. So this one has it. Now the difference between cervical and lumbar. Now we are done with cervical and thoracic. So for cervical and lumbar, cervical, it has a reduced transverse process. As we have said earlier, the transverse process is reduced, though it's more prominent than that of the thoracic. But when you compare it to lumbar, you know, it was one that has a very long bone part like this. So meaning that his own, it has a long and large transverse process, but this one, his own will be reduced transverse process. So his own is reduced like this. So that's number one. Number two, small neural spine. That means what is pointing up here is small neural spine. But this one, his own neural spine is broad and massive. It's very broad, going up like this, and it's massive, large. Wide neural canal in cervical. His own neural canal is big enough, wide neural canal. But this one, his own neural canal is narrow, so it's not that wide. So as you can see here, so his own neural canal is not wide enough, it's somehow narrow. So that's for the lumbar. Then vertebral canal is present in cervical. That means tiny hole where blood will pass. But this one doesn't have any vertebral canal where blood will pass. Then the centrum of cervical is either small or absent. So that means before you can see the centrum, so it will be difficult to see, though it is there, but it's not always very visible. So but for lumbar vertebra, centrum is present and is well developed. We can easily see the centrum in the lumbar vertebra. As you can see here, is very large. So large centrum is there. So then another one we'll be looking at is sacra, which is the number 4. Sacra is found in the lower abdomen, the lower abdominal region. So his own bones are always fused together. So his bones are fused together. So it means they are immovable joints. So just like the skull, you know, the bones in the skull also are immovable. So the sacral, they form fused bones, and they have a solid mass bone called sacrum. So they come together and form just one. You can see them here. So these are actually different bones forming sacrum. So the sacrum, this is a bone, a bone, a bone, so all of them together as one. So they are actually fused together. Then the first sacral vertebra is bigger than the rest, which decreases progressively in size. What are they saying is that the sacra you are seeing at the top here is larger. So it means if you start from the upper part is large, but by the time you start coming down, the size will start reducing. So that's for the sacra. So the upper part is larger while the remaining ones are reducing as you come downward. So that's for the sacral vertebra. Then the first sacral vertebra, it has a small neural canal where vertebral column will be passing. So it has a canal. So that's for number one. So you can see the canal here. So it has a canal. So here. So that's for the first sacral. So for this first sacrum, so it has a canal. Then it has a large centrum. So it has a large centrum. So when I say centrum, talking about the big bone that we always mention. So that's the large centrum. Then another point is it has a neural spine. So neural spine, but its own neural spine is reduced to a small notch. Instead of pointing his own neural spine, it's just reduced to something very small. So, and that's all these tiny things you are seeing here. So they are representing neural spine. So they are very short. So then number six, the first sacral vertebra has a pair of transverse process. The first, it means if you start from here, so on the left you will see transverse process, transverse process. So that's from the first sacrum. But if you start coming down, you will not see transverse process again. So that's for that one. Then the function, what's the work of this sacra? So they are joined to the pelvic. So sacrum, as you can see it, pelvic girdle will join, they will attach to it like this. So the pelvic girdle goes up like this, goes up and then connects to this sacrum. So it means they are working together with the pelvic girdle. So, and why? Because they want it to be rigid and to give strength. So because our weight, that's where our weight is. So the transverse process of the first sacral vertebra, they are broad, and its facets articulate with ilia of the pelvic. So that means they are facets. When you talk of facets, that's the face. So this side there, they are always attached to the ilium of the pelvic girdle. So this is the pelvic girdle. The ilium is beside it like this. So they attach to it. So we move to cauda, which is the tail part of the vertebral column. The cauda, it is reduced to mass of rectangular bone called centrum. So it's reduced to what we call centrum. So remember, is human doesn't have tail, but we have an animal has tail. So the caudal bone was just reduced to something that is like a rectangular bone, a rectangular bone. So which is called centrum. It has a projection on it for attachment of tail muscle. So it means the tailbone is for tail muscle. In man, the caudal vertebra is reduced to four bones, which are fused together to form structure called coccyx. So for human, there is no tail, but the bones are joined together and they call it coccyx. So the coccyx is tucked in between the ischium. So it means instead of talking about the tailbone, we'll be talking about coccyx. So that coccyx is now entering the ischium of this sacrum. So the ischium of this sacrum, that's where the coccyx is attached to. We have talked about the ilium, that one is just beside here. So ilium, ischium. So then the pubis symphysis is the last one. So we are still coming back to that. Now, functions of the cauda. The coccyx stabilizes the rigid pelvic girdle. So it's to make the pelvic girdle stand firm. Then coccyx houses and protects blood vessels. Coccyx will house and it will protect blood vessel and nerve fibers from under the ischium. It can also support the tail. They are working with the tail. So what are the characteristics of caudal vertebra? So the characteristics of caudal vertebra, there is no neural spine. Remember, is the tailbone, so no pointing projection. It has no neural canal like a big circle, so where neural spine can pass, it doesn't have that one. It appears as a solid, just like a rectangular mass bone, no transverse process. So it means most of the things other vertebral column are having, this one is not having it. So we move to ribs and sternum. What can we say about the ribs? The rib cage is formed by 12 pairs. We have 12 pairs of ribs. So, and then we have sternum. Sternum is the breastbone, the one at the center. Then the 12 ribs, they are around like this. So the ribs and the sternum, they are working together. The sternum in human consists of just a single bone. It's one that looks like a thigh. So while that in rabbit is made up of 7 small bones. 7 small bones. So the ribs articulate with with the thoracic vertebra at the back, and then curve to the front to attach by means of elastic cartilage to the sternum. So meaning that if the ribs is coming from the front, the ribs will be touching the sternum, but if it's going to the back, it will be touching the thoracic. So, and there is a cartilage that is holding it. So however, in humans, only the first 10 pairs are attached to the sternum. That means out of the 12 ribs, only 10 of them are touching the sternum. So, and that's why they are in layer. The last 2 pairs, they are free, they are not touching the sternum. They call them floating ribs. Floating ribs. So, and out of the first 10 that was mentioned, so we have those ones we call true ribs. The first 7 ribs are true. The next 3, they are false ribs. While the remaining 2, we call them floating ribs. So from the vertebra we have mentioned earlier, you can get their distinguishing features here. The atlas, his own is large neural canal, no centrum, pair of faces, so and so on. All I've mentioned, they are here. You can just go through them again. So to round up this particular topic, so we'll be looking at the long bones of the appendicular skeleton. The long bones. So we have seen all those ones that are the axial, the center. Now remaining those ones that are away from the body, so we call them the long bones of the body, or you just say appendicular skeleton. So, and after that, that will be the end for this class. So then we'll continue with joints later. So looking at the long bones or appendicular skeleton, so what can we say about the long bones or the appendicular skeleton? So we said they are the bones that are away from the center. Bones that are away from the center, and I've actually listed them earlier. So one of the bones that are away or appendicular skeleton, we have the pectoral girdle. So those ones that include the scapula and the scapula and also the clavicle, which is the shoulder bone. So that's the pectoral girdle. Then we also have pelvic girdle, the one that I say is at the waist region. The forelimbs, those ones that make up the arms, the upper and the lower arms. Hind limbs, those ones that make up the legs. So these are all appendicular skeleton. So from pectoral girdle, as I said, it's made up of scapula. Another name for scapula is shoulder blades. Then we also have what we call clavicle or collar bone. So the scapula and the clavicle or collar bone. And we have another thing called coracoid. So they all make up the pectoral girdle. Now in mammals, the scapula and the coracoids are fused to form what is called scapulocoracoid. So the scapula is a flat bone. It's flat. It has one head-like end with 2 processes, which are the coracoid process and then the acromion process. So when you draw your scapula, you will see coracoid process and you see acromion, and there will be a deep notch in that scapula, a deep notch. They call it glenoid fossa. So the deep notch is a glenoid fossa or glenoid cavity. Then it also has the rounded head. There's or let me say the rounded head of humerus will come to that glenoid cavity. That means that depression or deep notch. So the deep notch, which is the glenoid cavity, that's where the head of humerus will fit into, and then this will make up the ball and socket joints. There is a muscle we call tricep muscle. They also originated at the scapula and also the head of humerus. So this is the structure we are talking about. So this is the scapula that make up the that made up the other girdle, which is the pectoral girdle. So as you can see, this bone is actually flat. It's flat. So it's always at the back. You know, when you wear suits, there is a particular part of the suit which is at the back that is always like a foam, or where they always beat someone at the back. So that's where the scapula is. So let's look at the structure of this scapula one after the other. To start with, you can see the two parts they mentioned, the acromion and the coracoid. So these two parts are special parts of the scapula. Acromion, coracoid. You can just use AC to remember, air conditioner. You know, since the scapula is also flat, just like arm fan. So an arm fan will give you air, like a kind of air. So it means AC also will give you a kind of breeze. So the same we use it to remember acromion at the end, acromion, then coracoid beside it. Now this is the deep notch. So this deep notch, suprascapular notch. So that notch is what we make up what we call glenoid cavity from this notch here. So which is a glenoid cavity, meaning that that's where the head of the humerus will fit into. Then there is a spine here, a spine, the center spine. So that's the spine of the scapula, or you say scapular spine. Scapular spine. It also has a middle part called medial border. The one beside is a lateral border. The one in inferior border. So that is what we have for scapula. So having the deep notch where your head of humerus will enter, they call it glenoid cavity, having two special parts, AC, acromion above, coracoid below. So then the notch where the glenoid is connected to, then the middle part called media, then the other one which we have mentioned there, that's the blade. Okay, so we are moving to forelimb. So when you hear forelimb, talking about the bones that makes up the leg. So the forelimb, we start with humerus. Or sorry, not even the leg is for the hand. Hind limb is for the leg. So forelimb is the limb that makes up the hand. And looking at the bones that makes up the hand, we start with humerus. Humerus is at the upper arm. The upper part of your hand is the humerus, is part of the forelimb. And then apart from that, we also have ulna and radius. These ones are the lower arm, the lower part of your hand. So that's for the lower part where we have carpals in the wrists and phalanges in the digits. So let's start with the first part of the forelimb, so which is the humerus. When we look at humerus, there is this head. So it's this head that will enter the glenoid cavity of the scapula to form ball and socket joints. There is a groove here, a groove like a notch. They call it intertubercular groove. That is within the tubercle, intertubercular groove. Then there is something at the back here that is great. They call it greater tubercle. But under here is smaller. We call it lesser tubercle. You can use tuber of yam to remember. You know this thing looks like tuber of yam. So it means you use your hand to carry tuber of yam. So lesser tubercle, greater tubercle. The groove is here in the middle, intertubercular groove. Then there is what we call deltoid tuberosity, because there is a deltoid muscle here. So deltoid tuberosity. Then at the line here we have lateral epicondyle. Anything condyle. Condyle is the part that is close to the trochlea. Trochlea is that part that is connected to the ulna and the radius. So once you see trochlear, so you can use throw as if you want to throw, and if you will throw, you use your hand to throw. So meaning there are two bones here, ulna and radius. So it is the trochlear that joins those two bones with this humerus. So and for the tuberosity I mentioned earlier, I said use tuber of yam to remember lesser tuberosity and greater tuberosity. So then the functions of that humerus, that's the upper arm, is for attachment surface for bicep and tricep. It means muscles are attached to this bone you are seeing here to lift anything. Then the bicipital groove anchors the bicep muscle. It forms the ball and socket. It means immediately you join the humerus to the glenoid cavity, so you have the ball and socket joints. That means the joint that can rotate 360 degree. It can also form hinge joints at the elbow. You know, this humerus at the top, it will form ball and sockets with the scapula, but below where we have, remember I told you there is something we call trochlear. So like if you want to throw stone, so it means at the trochlear where the radius and ulna are connected, there is a joint called hinge joint. It can rotate, it can only move 180 degree. So that's for the ball and the hinge joints at the elbow. Then it allows free movement of the arm. It means if you want to move your hand, it is the humerus that will enable the free movement. Now when we come down to the lower part of the hand, we have what we call radius and ulna. That means those two bones that are attached to the humerus at the trochlea. So they are called radius and ulna. Now this radius and ulna, they form the bones in the lower arm. That means the lower part of your hand. So in the lower arm, the radius is shorter, so you can use circle to remember that the small line here is a radius, is shorter and is lying on top of the ulna. So you can see it here, radius is here, ulna is at the back, longer. So it lies on top of the ulna. So they both form the sigmoid notch. So both of them will form a sigmoid notch, that means a bending notch, into which the trochlea of humerus will fit. It means as the humerus is coming, it will fit. The trochlea of the humerus, it will enter that radius and ulna. So meaning that that trochlea is coming um, from the humerus. So it is actually not for radius and ulna. So meaning that that's the humerus is the one that has the following. It has the head of humerus, it has greater tuberosity from tuber of yam, it has lesser tuberosity, it has a deltoid notch. That means like where the deltoid muscle is found. Then if you now come down, so you now see the trochlea. So it means it has a trochlea, like to throw stone with the hand. So it also has a trochlea. So, and that's where the radius and ulna are now attached. Now, what is now the radius and ulna having? So their own is called olecranon. Olecranon. So you can use the OLE like ole, like a thief. So using hands to steal. So that's olecranon process. So that's for the long hand. So you can say maybe it's using the advantage of the longer parts. So the olecranon process. So meaning is using the longer part, which is the ulna. So you can say ulna olecranon, ulna olecranon. So the olecranon process from the ulna will now be attached to the trochlea. So because we said the long humerus also has a trochlea, as if it's throwing stone, so they are attached together. So olecranon process, trochlea notch. So the trochlea from the humerus will enter this notch that is beside the olecranon process. So if you come down, you see another part of the radius and ulna. We call it head of the ulna. So head of the ulna. So it means that's where the carpus is coming to attach to. So that's for the joints of carpals and the ulna. So let's see radius and ulnar functions generally. So they are the point of attachment for the insertion of bicep and tricep muscle. So radius, ulnar in our ends, so they are there to hold the muscle, bicep and tricep. They also provide large surface area for attachment of extensor and flexor muscle. If you want to extend your muscle, so it is also found at the radius and the ulna. So the muscles attached to this radius and ulna, they can contract, they can relax to move our hands and also to move our digits. That's talking about our fingers. So they are attached in such a way that they can twist the hands. Now look at carpals. When you talk of carpals, those bones that are inside our wrists, that's where you put your wristwatch. They call them wrist bone. They are 8 in number, and their shapes are irregular. They are not regular shapes. So these wrist bones are held together by a tough ligament. A ligament always joins bones together at the joint. So what is the function of these carpals? They form hinge joints, which allows for the, though this one shouldn't be hinge, it should be sliding or gliding joints, because our carpals can slide. So for sliding or gliding joints. So then metacarpals, that's the, in our palm we have the metacarpals. So there are 5 metacarpals in one hand. Then the thumb has the shortest metacarpal. So while other, if you draw your fingers, you see that the thumb is not that long. So that's why it doesn't have enough metacarpals. So what's the function of metacarpals? They form the shape. They form the shape of the hand. So that's where you have your palm. Your palm is your metacarpal. They provide surface area for the attachment of muscle. So muscle of the palm are there. Then finally we have phalanges. That means those fingers, the long fingers are the phalanges. So these are the bones of the digits. So they are bones that make up the hands and the toes of the foot. 3 phalanges can be seen on each finger and toe, with the exception of thumb and large toe. So the thumb and the toe, they don't have 3 exceptional fingers. So there are a total of 56 phalanges in the human body. So it means in our fingers alone we have 56 bones there. So with each hand and foot having 14 each. So it means all the phalanges in our body are 56. So mean that 14 in the left hand, 14 at the right hand, another 14 left foot, another 14 right foot. So meaning 56 altogether for phalanges. So you can use the pha as 5, the s of the g's as 6. So 56 phalanges. Now, what's the functions of these phalanges? So they support the digits. That means support our fingers. You can use it to grip. Maybe you want to grip something or hold on something. Or if you want to walk, so especially these tetrapod animals. So if you want to walk, so you make use of the phalanges. They bear claw. That's where the claw of all these birds are found. If you want to climb, you want to dig, so like rats, so they have phalanges to help them. So this is what we call phalanges. So all these ones that are here, those ones that are at the end, they are distal. From the word distance, they are far. Those ones in the middle, they are the medial. Then those ones that is close to the body, they are proximal, like proximity, closeness. So that's for the phalanges. But in our palm, that's where we have metacarpals. Metacarpals, then our wrists. So that's where we have carpals. So this is the ulna, the long one, and the radius. So they are working together. Now, the hind limbs, talking about the legs. So we want to see the bones that are in our legs. So the first one, or let's first talk about the hind limbs generally. So it is made up of the femur. The largest bone in our body is called femur or thigh bone. The bone in our thigh, so it's called femur, or you say thigh bone. So, and apart from that, we have what we call tibia and fibia. That's the 2 bones in our legs. The one at the upper part is femur, but the two ones that are the lower parts are tibia and fibia. So then we now have tarsa in the ankle where you wear your socks. So we have tarsa. So we also have what we call metatarsals. So that's our foot where we wear our shoes. So we have metatarsals. Then phalanges is in our digit or your toe. When you say your toe, so then as I said earlier, the femur is the largest or longest bone of the body. What's the function of the femur? It forms a ball and socket joint with the ilium, allowing free movement of hind limb. When you draw your pelvic girdle, so assuming this is the pelvic girdle here, let me use this. So if you have, when you have your pelvic girdle in this way, so you will see a hole here called acetabulum. So that acetabulum, that's where the um, the long femur is attached to. So it means that part where it is attached to this, as I said earlier, it forms a ball and socket joint with the ilium. So it means this place is the ilium. So where we attach our the femur. Then number two, it forms attachment surface for the thigh muscles. So it means the thigh muscle, that's the muscle in our legs. So it is attached to that femur. End, the distal end forms a hinge joint with the patella, tibia, and fibia. So that's the distal. That means the part that is far away, it will form a hinge joint. That's the one that forms 180 degree with the patella, tibia, and fibia. So as you can see, this is the femur that we are talking about, the the largest bone in the body. So it has what we call the head. So we have the head of the femur, so which is entering the what? Acetabulum. Acetabulum is acetabulum. Acetabulum. So that's where the head of this femur is entering. And instead of greater tuberosity that we have in the humerus, for humerus, I say you can use tuber of the arm to remember, and his hand we used to carry tuber. So, but this one you say trochanter. So this one has a trochanteric fossa. So this one has lesser trochanter, greater trochanter. Instead of greater tuberosity and lesser, this one has a greater and lesser trochanter. How will you remember? You can just use the bottle top that they call canthers. So to remember, so as if at your femur you put a canthers there, so which is trochanter. So as if they put canthers there. So that's the greater and the lesser trochanter, then the head of the femur. Always know that a long part of a bone is called shaft. So this is the shaft of the femur. Then if you come down, you see condyle. Condyle is where you attach another bone. So there is a lateral condyle that is going side by side, medial, the one in the middle, articular surface for patella. That means where the small bones here is attached. So that's for the lower part. If you are going to the legs, so you'll be seeing condyle. So you can use maybe this, when your one's leg is broken, in Yoruba they will use the one that's it has broken. So meaning from this condyle, that's where there is attachment of another bone, which we call the tibia and fibia. So at the condyle region, we have the tibia and fibia attached to it, and we also have the kneecap attached to it, or the patella. So now let's now go to the tibia and fibula, the two bones that are connected to the femur. So these ones will provide large surface area for the attachment of muscles of the leg. So they provide large surface area for the attachment of muscles of the leg. The muscles that move the foot have their origin attached from this tibia and fibia. It means if muscle is coming from the leg, it goes to the foot. They form the ankle joints, which allows the movement of the foot along the plane. When you hear ankle, from your ankle socks, so there is an ankle joint here connecting tibia, fibia with the tarsals. So that is the tibia and fibula. So as you can see, this is the tibia and fibula. So the big one is the tibia from letter T. Once you remember T for tibia, so the tall one, or use the word T for tall. So the large one is the tibia, then this small one is the fibia. So that one, as I said, condyle. So once you remember the so condyle. So that's the part that joins with the femur. So at the kneecap, so the medial condyle in the middle, the lateral. So then we also have the head. So this one also actually has a tibial tuberosity, just like the tuberosity we had in humerus. So then the tibia bone, fibula bone, so they are all there. Now, the last one is the tarsal, metatarsals, and phalanges. Then we move to pelvic girdle. So when you talk of tarsal, metatarsals, so tarsals, they are the ankle bones where you wear your ankle, your socks. So ankle bones, they are the tarsals. They are also 8 in numbers, just like the carpals. They arrange them irregularly in 2 rows. They arrange them in 2 rows. So the tarsal can provide attachment surface for the strong muscle of the leg. They form the ankle for movement of the foot along one plane. Muscles for moving the foot and the toes, they attach to the tarsals. So if you want to move your toes, the muscle is coming to that tarsal. Then metatarsal, which is the foot bone, those ones are 5. The metatarsal, they are also supporting the foot so that you can walk. And metatarsal is the one that is joining with phalanges. That's the toes themselves. They support them. Lastly, it will provide surface area for attachment of foot and toes muscles. And phalanges, they are the bones of the digits or toes. The big toes, they have just 2 phalanges. So the remaining 4 toes, they have 3 phalanges. That's why you see that the toes are not equal. So it's 2 that is in the short one, but 4 are in the longer one. So the phalanges will support the toes, and they are used for walking, for gripping and digging. So if you want to walk, you want to grip the ground, you want to dig, so it is the phalanges that is supporting your toe. So now secondly, it provides surface area for the attachment of muscle. So take note of the last phalanges. They call them distal. That means they are distant, they are far away from the body. But the middle one is called medial, while the one that is close to the body is called proximal. Then metatarsals, those ones that are in the middle of your foot. So it also has medial, intermediate, lateral, and so on. So that's for that one. Then pelvic girdle. So we want to look at pelvic girdle, the one I said we have in our waist. That's the pelvic girdle, and that will be the last thing for today's class. Now we look at the pelvic girdle. This consists of ilium. Ilium is the hip bone, your hip bone. So we also have ischium and we have pubis, so which are fused together on each side of the body. So the 3 major parts of pelvic girdle are ilium, ischium, pubis. So they fuse together on each of our body as the innominate bone. The 3 bones are joined together at the pubic symphysis. That means the point of connection of the 3 of them is at the pubic symphysis. As you can see this diagram here, this is the pubic symphysis. So the pubic symphysis is below here. So meaning that the ilium, see the ilium here, the ilium, then the ischium, the one that is below. So ischium is below, ilium is beside. So ilium, letter L here, ischium is here, then the pubic symphysis is now here. So meaning that as the ilium is coming, as if you want to write letter L, then it's curved. You know, when you want to write ischium, you curve your S, it's curved and then meets the pubis at the center. So ilium coming as if you are writing letter L, ischium as if you are curving the bone, then pubis at the center they meet. So the same way again here. So the ischium curving the ilium as the long part, so then they meet here. So the meeting point of the three is at the pubic symphysis. So the distal ends of these bones form a cavity called acetabulum. So once you get to the distal end, that means as you are coming down like this, the distal end, so you will see your acetabulum. That means here, so where the head of femur will enter, so that at the distal end, so we have acetabulum. That's where the head of femur will form ball and socket joints, and that's the hip joint. So here we stop the class for today. So the next class will continue with joints, and also we round it off with supporting system in plants. So thanks for listening.